Good evening, folks. I have discussion D for you. We are discussing how cannabis can help in dementia agitation. So let me get set up for the show and then we will discuss the topic. Okay? Give me a couple seconds, please. Okay, the title Quieting How Cannabis, the Quieting, How Cannabis Helped Ease Dementia Agitation. Okay, here we go. I made a little narrative for y'all. Narrative presentation tonight for D. Agitation and dementia is not simply a symptom. It is a storm. Sudden, disorientating, and often devastating. It sweeps through a person whose mind can no longer reliably interpret the world, leaving fear in its wake. Families witness it with helplessness, grief. Clinicians confront it with a mix of compassion and frustration. And the patient trapped inside the storm experiences a kind of suffering that is both visible and unreachable. This is the story of how cannabis based medicine, still emerging from the edges of clinical practice, offered a gentler way to quiet the storm. Title: The Storm Before the Calm. The first time Margaret's daughter saw her mother pacing in the hallway of the memory care unit, she felt her breath catch. Margaret had once been a librarian who organized her life with quiet precision, alphabetized bookshelves, handwritten grocery lists, a garden mapped out in neat rows. She had been a woman who lived in who lived order, who found comfort in predictability. But when dementia had rewritten her inner world, now Margaret moved with restless urgency, her steps sharp, repetitive, her eyes scanning the hallway as if searching for an exit from a place she didn't recognize. Her hands trembled. Her jaw clenched. Every sound seemed to startle her. "Mom," her daughter whispered, approaching slowly. Margaret recoiled. She didn't know the voice. She didn't know the hallway. She didn't know herself. Agitation in dementia often begins this way. A misinterpreted shadow, a confusing room, a caregiver's hand that feels unfamiliar, the brain struggling to make sense of sensory input, reacts with fear, and fear becomes movement, pacing, shouting, resisting care, striking out. Clinicians tried to help. They reached for antipsychotics, benzodiazepines, sedating antidepressants. These medications can quiet the body, but they often dim consciousness. Families describe this as a second loss. She was still alive, but she wasn't there anymore. Margaret's daughter wanted her mother calm, but she also wanted her mother present. A different kind of medicine. The idea of cannabis came from a hospice nurse who had seen it help other patients, not as a cure, but as a comfort. She spoke gently, acknowledging the stigma, the uncertainty, the early nature of evidence. But she also described something Margaret's daughter had not heard in her mother's in months: relief without error, CBD dominant formulas. With low dose THC, she explained, sometimes eased agitation without causing heavy sedation. They seem to soften the edges of fear. They helped patients sleep more predictably. They reduced the sensory overload that often triggered agitation. Margaret's daughter hesitated. Cannabis still felt taboo, a substance whispered about rather than prescribed. But she also knew what wasn't working. She knew the toll agitation was taking on her mother, on the staff, and on herself. With clinical oversight, they decided to try. The first gentle shift. The change was not dramatic, it was subtle, almost imperceptible. At first, Margaret's pacing slowed, her hands unclenched. She allowed the nurse to help her with her sweater. She sat in a chair by the window and watched the trees sway outside. She didn't fall asleep. She didn't slump over. She was awake, alert, in her own quiet way. Her daughter, her daughter sat beside her, unsure whether to speak. Margaret looked at her, really looked, and though recognition didn't return, the fear had softened. It was the first moment of peace they had shared in weeks. Families often describe this shift with awe, not because cannabis transforms dementia, it doesn't, but because it can transform the experience of dementia with the aggression form that once felt like a storm because a breeze, the patient who once seemed unreachable becomes present again, even if only for a moment. In the end of life care, moments matter. Why cannabis may help. The endocannabinoid system regulates mood, sleep, sensory integration, and neuroinflammation. Dominance domains deeply disrupted in dementia. CBD appears to reduce anxiety and inflammation. Low dose THC may help with relaxation and sleep. Institution together, they may modulate the hyperarousal that fuels agitation. This is not about intoxication, it's about reducing distress. High dose THC can worsen confusion, which is why clinicians exploring this therapy focus on CBD dominant. Hold on. Combinations. The goal is not to quiet the patient. The goal is to quiet the suffering. The last chapter made gentler. In the final weeks of Margaret's life, agitation did not disappear entirely. Dementia is too powerful for that, but the episodes became fewer, shorter, less frightening. She slept more. Predictably, she accepted care without fear. She sat with her daughter and listened to familiar music. Her daughter described these days as a gift. She wasn't drugged. She said she was just calmer herself. I could sit with her. I could hold her hand. In the end, Margaret died peacefully, her daughter beside her, the storm quiet at last. A hopeful, responsible future. Cannabis based medicine is not a miracle. It is not a cure. It is not appropriate for every patient. The evidence still early, and clinicians must guide its use with care, caution, and ethical clarity. But for some patients, especially those in the final stages of dementia, it may offer something profoundly human, comfort without agitation, a way to ease agitation without stealing wakefulness, a way to preserve connection without inviting fear, a way to let the final chapter unfold with gentleness. Okay, guys, that is D for you. I will see everybody later for shows. Until then, Gator Wellness, take care, folks.